Hi everyone, we are here today. We're just gonna let people join us. Welcome everybody. We are gonna let some people join us here. I'm gonna find Cleve here in our chat so I can get him added. Thanks for joining us, folks. We're letting some people fill in here before we get started. Hey, Cleve.
Hi.
We figured out the technology, Cleve. It
You
was
nearly gave me a heart attack.
it was touch and go there for a minute, but we pulled it together between the two of us. Good thing we have some good tech support here at SFAF to help us out.
Yep.
We're gonna give folks just another couple of seconds here to file in. I still see folks joining us, and then maybe we'll get started in our conversation.
Great. I look forward to it.
All right. Why don't we go ahead and just jump right in? Cleve, we are just 24 hours, a little over 24 hours into a new administration. And I guess I'm wondering, you've been through this many times, and I'm wondering how you're feeling at this moment.
Well, I've been through a lot, but I've never been through this. This is different. This is unprecedented. And I think we have to acknowledge that right from the get-go. And I'm grateful to you and the team at SF AIDS Foundation and to everybody that's joining us tonight. Thank you. We are entering a new era, and the impact on our work globally, nationally, throughout California, and here in the San Francisco Bay Area is going to be impacted severely. And I think that in this moment we have together now this evening, I'm really interested to hear from you and what other leaders in our cause are thinking at this moment. And I also want to make it very clear to those who are listening and who will see this recording that it really is up to us now to step up. And I remember a time when this pandemic began and there was no support from the government, none. And we in our communities, especially what we now call LGBTQ, stepped up and raised the money and created the systems of care and education and treatment. So we have it within us. And at this moment, it's appropriate to feel fear. It's appropriate to feel anxiety and anger, even rage. But what is not appropriate is to think that we can give up. And I also want to be really clear with everybody listening that this is about fundraising. This is about policy, and it's about politics, and it's about the state of our world, and it's about fundraising. And we need you to step up. We need you to donate. So I'm going to be coming back to that repeatedly. I'm just giving you a fair warning. But I'd really like to hear about this call that you had this morning, Dr. TerMeer.
Yeah, I want to thank you so much for being here with us tonight, Cleve. And before I jump into the call I had this morning, just want to echo your sentiments about the importance of fundraising and weatherproofing organizations right now, like San Francisco AIDS Foundation. Now more than ever, it's important that we think about our future and about our ability to continue to provide life-saving services for people living with and affected by HIV. Our program tonight and our conversation is really centered around this theme about unbreakable futures. And we're really trying to think about a future, imagining a future that's built on that resilience and the solidarity that you talked about, a shared determination where we can unify and weather the storm that is coming over the next several years. So I'd really encourage folks to think about how you're going to get engaged. And one of those ways is by donating. So you'll hear us both talk about that a lot tonight. In the chat, you'll see a link, which is sfaf.org/futures. That is one way that you can donate to San Francisco AIDS Foundation tonight and moving forward to help our cause. As Cleve mentioned, we have been trying to prepare for what this new administration will mean for people living with and affected by HIV in our country. In addition to being the CEO of San Francisco AIDS Foundation, I have had the honor of being one of the two co-chairs of the AIDS United Public Policy Council for the last 8 years. And quite honestly, at the beginning of 2024, I had started talking to them about stepping down, thinking that we were headed towards a different moment, and that I had the opportunity to really focus on our state and local efforts, that I would give the opportunity to someone else to take the reins and to lead our efforts. But when the reality set in that we were going to have a second era of Donald Trump, and that we were going to have to face a new administration that was very different than anything we've ever faced. This isn't the same iteration of Donald Trump that we saw last time, where he was still in some ways coloring within the lines. We still had some semblance of checks and balance in place. This is a new world where there is no playbook. And we have to figure out how we will navigate the reality of the world that we're now handed. So this morning, the Public Policy Council, which is made up of more than 60 HIV serving organizations around the country, met for over 3 hours to really assess the landscape. Now, these are CEOs and policy experts from leading HIV organizations to think about the impact on the federal budget and on policy, and to think about many of the executive orders that have already come to play in the first 24 hours of the administration. We know that there is a lot hanging in the balance, some things that will happen immediately and some things that will take some time. Now, things that we've seen happen already, all semblance of HIV, LGBT language are gone from the whitehouse.gov website. This happened in the first Trump administration and have happened already in this moment. We're worried that we will see potential attacks on the Office of National AIDS Policy, which was dismantled during the first Trump administration, as well as the President's Advisory Council on HIV and AIDS, which did survive the first Trump administration, but was really reconfigured in a way that was planted with loyalists, folks that would do and perform in the way that he wanted to govern those bodies. So our time this morning really focused on what we anticipate in the budget, and what we anticipate these executive orders might look like, the legal battles that are ahead of us to try and stop them in their tracks, and what we can do to really not be our own worst enemy, which happened many times in the past, but how we can really unify and pull together in the months ahead, but certainly over the next several years when we'll need to protect and preserve our movement.
As I look at the landscape ahead, one of the things that's first on my radar, and I think this might be a good way for us to approach an outline of what we think might happen, is the reauthorization of PEPFAR. For those of you watching who don't know what PEPFAR is, that is the primary conduit of US dollars to the rest of the world, especially to sub-Saharan Africa and other parts of the world where HIV/AIDS is still a critical problem, and folks don't have the access to the treatments to the extent that we have it in our country and in Canada and Europe. PEPFAR was typically authorized in 5-year allotments. It came up last year in March, and they chose to only renew it for 1 year. So that's coming up in March. What's your assessment of the situation for global funding?
Yeah, and I think it's something we're going to have to continue to monitor incredibly closely. We were a little bit worried to see Barbara Lee no longer in her spot. Representative Barbara Lee has been such a champion over time for our cause. She's been the head of the HIV caucus and has championed the reauthorization of PEPFAR throughout time. She has very recently worked very closely to ensure that we have folks in place to continue to champion those efforts for us. We were hoping that we would find a singular champion for those efforts on the road ahead. We've not secured that, but what we have secured is Illinois Democrat Representative Robin Kelly, who will take over the PEPFAR reauthorization efforts, and our colleagues at AIDS Foundation of Chicago have worked really closely with Representative Kelly over time. So we're working through our existing coalitions and our partnerships to ensure that we're advocating every day in that regard. And then, Representative Lee also played a vital role in the overarching HIV caucus and advocating through the appropriations and budget process for HIV funding as a whole. So we know that now we know that Wisconsin Representative Mark Pocan, who was the former chair of the Equality Caucus, will take over the HIV caucus headed into this next year. This caucus has also always had a Republican co-chair. That is proving to be a little more complicated in the current world. And so we're trying to find a bipartisan leadership in this moment for that caucus. But, we're in a real dangerous moment. I mean, a lot hangs in the balance in this moment of when we think about funding in particular. We have very specific buckets of money, and we're talking about not just the programs that people think of off the top of their head, like the Ryan White program or the housing opportunity with people with AIDS. But there are many programs that are utilized by people with HIV and AIDS around our country that are tied to the Affordable Care Act, that are tied to the Medicaid program. We're talking about trillions of dollars tied up in Medicaid, the Affordable Care Act, and broader social services that are all potentially under attack in the reconciliation process that we're really going to have to pull together and advocate for to ensure that we don't fall back into an era where HIV could be considered a pre-existing condition, or where folks are going to be pushed out of their system of safety and care.
Yeah. One of the things that concerns me greatly right now in this moment is that there's a real generation gap within our own movement, because we have a whole generation now of younger people who have grown up never seeing the devastation up close, never watching somebody die of AIDS, never seeing the misery that it causes. And so, and that's a happy thing. We don't want that.
Yeah.
But I'm really frightened because so many of the younger people that I communicate with are, for example, on PrEP. So they can take one pill a day. They're not going to get HIV. But many of them are paying for that through their employer provided healthcare plans. If we see the Affordable Care Act overturned or seriously modified, there's the question of coverage of pre-existing conditions. There's the question of coverage for PrEP, which is already, I believe, at the Supreme Court.
Yeah.
So people really need to get clear. And here in San Francisco and everywhere that I'm in touch with people around the United States, we see a funding decline already. And part of it is this generation gap. I think it really shows up in the drop in participation in the AIDS life cycle, for example, in California. So again, people really need to understand that there was a time in our past when we funded all of this. We created those systems. We built them out of nothing.
Yeah.
And I hope we don't have to go back to that exact moment in time. But let us be very clear that the death rate has come down and the infection rate has come down because of access to treatment and care, and because of the public education campaigns that have helped make access greater. So we're not anywhere near where we should be. And another example, and forgive me because I can't remember how to pronounce it, but the new medication out of Gilead, that's the twice-a-year injection. How do you say it?
Lenacapavir.
Lenacapavir.
Yeah.
It's my understanding that they submitted their paperwork to the FDA in December. So what's going to happen now? We don't know yet if RFK Jr. is going to be confirmed, but he's a known, cynic about vaccinations, and it's just so frustrating to be at this moment where we really could see ourselves getting to zero and caring for the people that already have AIDS and preventing it from going on for another generation. And I think we need to be very clear that AIDS could come roaring back if they turn back the clock on this.
Yeah, I mean, I think you raised such a an important point that, you know, the ACA, the Ryan White program, HOPWA, all of these programs are systems that we helped build from the ground up. And I say we because San Francisco AIDS Foundation literally wrote some of these pieces of legislation at the earliest points of the epidemic, helping to build the system of care and the San Francisco model that so many folks have replicated around the world. We have established a set of federal agencies and practices through organizations and federal arms like the NIH, through the Office of AIDS Research, through the Minority AIDS Initiative, all programs that are very likely to face significant budget cuts or potentially be on the chopping block. In the first administration of previous and now current President Trump, there was a proposal to end the Minority AIDS Initiative, to end all AIDS education and training centers, to cut back vital housing dollars for people living with HIV and AIDS. I mean, we could see potentially, if these programs are tailored back, the return of waiting lists for AIDS drug assistance programs. These are all things that could be a reality. And so I think now more than ever, we have to find the ways to advocate. So one way that folks can do that is by getting involved on the local level. You can join our HIV advocacy network. There's more information on that on our website, which is sfaf.org. And again, tonight is a fundraiser, so we hope that you'll visit our link at sfaf.org/futures and consider making a donation of any size tonight to support our efforts.
And I understand there's a matching grant for tonight's efforts. Is that correct?
That's correct. So tonight, we're very excited to announce that Chevron has stepped up and is matching $40,000 in our efforts. So we have been working with Chevron for a number of years. They are a longtime partner in the fight against HIV. And tonight, as we think about an unbreakable future, they have started off our campaign with a $40,000 matching gift for all of those that make a gift tonight or in the next several weeks.
Well, that's great, and I hope it will encourage people to click on the link and make a contribution. But we also need to be realistic that even before the election, we saw a retreat by many corporate sponsors in the past. We've seen it with AIDS Life Cycle. We've seen it with foundation work. And when I look who was up there, you know, on the platform with the new president, I think we need to be very make a very cold assessment of the reality that a philanthropy that was raised up as an example, I think, is going to now be mocked and derided. I'm really concerned that the corporate dollars are going to diminish further. When we saw here in San Francisco, the Levi Strauss Family Foundation stop their funding that had been going on for years and years and years. And there's others across the country. So again, to me, it just underscores the need for us to step up and do that community level work. And I hope that this message can reach younger people. And I feel like I'm a really inadequate messenger for that because I'm 70 years old. But I know what it was. I remember so vividly what it was like to live during the early years of this pandemic and to see so many of my friends get sick and die horribly. It's very hard to break through all the noise and let our young people know that their futures are at risk right now, and we need them to step up, and we need them to, you know, write checks and write letters and call their representatives. But we also need them to really take responsibility and lead us forward, because the years ahead are very, very difficult.
Yeah. Cleve, one of the questions that's come in is, how to balance the attention on local advocacy with national concerns that are happening at the same time. So I know that, for us at San Francisco AIDS Foundation, we have policy staff working at all levels of government. So, we have a full-time staff member that spends time, Ernest Hopkins, who's worked for us for over almost 30 years, who spends his time in DC monitoring federal policy work and helps us understand the implications of how federal policy and budget implications will make their way from the federal government to the state and then have local impact. We certainly need to understand how the decisions that are made on the national level will impact local policy, and how federal dollars or impact from federal dollars will impact the work happening here in San Francisco. But we also have a real responsibility as a leader in the epidemic to be fighting for the rest of the country. The country from the earliest days of the epidemic has looked to San Francisco to be a leader, to be bold in our advocacy and in our voice. I still believe, despite the hard road ahead of us, that we will be the first city to get to zero. It will be a harder road now ahead of us, but we will get there. But we can't get to the end of the epidemic unless we get to the end of the epidemic in the U.S. South. And so we have a very vital role here in San Francisco to play in national advocacy and across the country. But I'm curious on your thoughts, Cleve, like throughout your time in working in advocacy, how do you balance the attention of local versus national advocacy?
I think that the national issues actually can be rallying points for local communities and really important opportunities to build solidarity between the states and internationally. So I think that and I know there's people who are watching this who are not from San Francisco or even living in the Bay Area, but all of us, wherever we live, I think can take the time to educate ourselves about the national and international aspects of this, get informed, and seize on those opportunities to build solidarity across these boundaries and barriers, and to not be complacent. Those of us who are in the San Francisco Bay Area, where we got very close to getting to zero before COVID hit. We were so close. I believe we were down to less than 200 new cases a year. Is that correct?
Yep.
So COVID disrupted that. Now it's going to be further disrupted. But that success rate was not mirrored everywhere in the country. And we still see the terrible racial disparity playing out once again, as we saw it also play out with COVID. So those of us who have the benefit of living in the urban centers that have good policy, good leaders, good elected officials, and some ability to backfill the anticipated federal cuts, we have a responsibility to the rest of the country. We have a responsibility to the rest of the world. I was recently in Canada, and they're not in quite as dire a situation as we are, but they're facing similar issues, particularly as the pandemic continues to unequally impact Indigenous populations within Canada. So those of us who have the benefit of living in places where we're still strong, we can't just rest on that.
Yeah. One of the other common questions that we're hearing right now are really about, this fear about funding cuts, obviously, and what the timeline of that looks like. So one of the things I wanted to make sure I covered was what the current reality may look like. The current FY25 budget appropriations process is moving a lot slower than people may realize. We are in a lot of gridlock because people can't really agree on anything. So there's a current continuing resolution that folks may hear about if you're watching the news every day. And that continuing resolution is keeping things moving until about March 14th. But at that point, there's not really an agreement on how to keep the government open and how to keep things moving. There is the possibility of another continuing resolution if things don't move quickly enough, and hopefully we'll get more information as we get closer to March, and we'll get a better sense of where the government is headed. But if yesterday is any indication, we know that there is a lot coming on the chopping block. We saw many executive orders come out yesterday, many of them incredibly dangerous and very harmful to the communities that are near and dear to the mission of San Francisco AIDS Foundation. So first and foremost, I want to take just a quick moment to acknowledge that one of the many executive orders that came out yesterday is a very harmful and hateful executive order that invalidates the lived experience of transgender and non-binary folks in our country. And I want to clearly state on behalf of San Francisco AIDS Foundation and me personally that for all of our community that we serve, your experience, who you are is valid. You are loved, and your identity is beyond question, and no executive order, no matter how cruel or misguided, can erase who you are. And we are here as an organization to continue to fight for you each and every day. But also to explain for a lot of folks who don't always get involved in the day-to-day of how policy on the federal government level works, that executive orders exist in kind of an interesting way. They don't have this immediate power to change law in the exact moment that they are announced. They don't take effect overnight. It basically is signaling intent. And while it's setting a really dangerous precedent when an executive order is announced, the implementation of those executive orders are often subject to a whole litany of legal challenges, and almost everything that was announced yesterday is going to have a lot of legal challenges against them. So we're talking about, identifying the attacks on trans and non-binary folks. We're talking about many of the challenges against DEI, many of the challenges against birthright citizenship. All of these things are going to face real legal challenge. Some, on the other hand, we saw happen in his first administration, and they potentially will just sail through. So leaving health organization, leaving the Paris Climate Agreement, the executive order that all federal employees must return to work. These are things that are a little harder to fight and probably a little less of a battle than some of these larger immigration LGBT community fights. They're all worth fighting for, but there's probably going to be a list of priorities that we have to work our way through, and several legal firms that have to work to prioritize what and how we fight for those things. So there were many, many, many executive orders released yesterday, but I just wanted to spend just a quick moment to acknowledge the fact that just because they were announced yesterday doesn't mean that they are law today, and that we're monitoring them very closely to ensure doing everything in our power to stop them in their tracks.
With the time remaining, I want to make sure that we spend some time on the situation here in California and San Francisco, but we can already see how the pain of what they're going to inflict is being deliberately ratcheted up. And one of the things that really struck me was that in his previous administration, the immigration and enforcement people were they stayed away from churches and schools. And so I think now we have a situation where clearly they're going to be aggressively going after immigrants, and in a way that is going to, I think, make people fearful of seeking health care. So how is this good for public health when people who may need health care are afraid to seek care? It is just, but I think the pain is the point, and they want it to be harsh. But here in California, we were looking at a potential budget surplus, and then half the state got on fire. So what's your sense of where we're at? I'd like to hear about that. And then I'm sure people want to hear about San Francisco and our new administration here.
Yeah, I think it's we had a lot of hope before the very tragic wildfires that began to occur, that news of a surplus could mean that we would have some protection from the impact of what federal budget cuts could mean. We have had a long history here in California of the state and even the city and county of San Francisco stepping up to absorb the cuts that often come for HIV prevention and care here in San Francisco. And we've been very fortunate that local and state elected officials have made that commitment time and time again throughout the epidemic to try and backfill those cuts along the course of the epidemic. I think what we are now facing, unfortunately, is kind of the perfect storm of federal budget cuts, a state budget crisis, knowing that we had a surplus, but now we have to figure out how to respond to not one of the most costly natural disaster that we have seen, and at the same time, a local budget crisis at the time that we have many social issues impacting our city that are all very costly to respond to. So we are uh, anxiously awaiting what will happen with the federal budget, knowing that the decisions that are made in the federal budget will arrive and land in California. We know that many of those federal decisions will hit a little differently for us. We have made really good decisions in California over time. We have done a lot in our policy to protect LGBTQ people and to protect the rights of California citizens. And we have done our best to create a social service infrastructure and a system of care that wraps around people in the best way possible. But federal budget cuts or a dismantling of Medicaid or Medicare, all of those things would impact us in a significant way because we've been able to leverage things like Medicaid expansion, like the ACA, to really expand our ability to offer care in a truly robust and comprehensive way to people around the state, but in particular to people living with HIV in an unprecedented way since the rollout of the Affordable Care Act. The state, we are hoping, will continue to best leverage the HIV dollars that it has. We have managed a very healthy AIDS drug assistance program over time. And we're hoping that the money that has been generated through our AIDS drug assistance program will be put to good use in the time of federal budget cuts and be able to absorb any cuts that may come. We're also hoping that the opioid settlement dollars and a variety of other things potentially could be used in thoughtful and strategic ways here in the state of California to help backfill various other programs so that dollars can be used in the most thoughtful and strategic ways to prevent the need to cut back on any services across the state. But obviously, federal cuts potentially mean state cuts, which then mean hard decisions at the city level. What I can say about the city of San Francisco at this point is that we have an entirely new playing field. We have several new members of our board of supervisors. We have a brand new mayor. We have a brand new mayor who did commit during the campaign to backfill any cuts to HIV that may come our way. And so we have reminded him of that in his first few days in office, and are hopeful to continue to remind him of that as decisions are made and they pass down our way. We're excited to see Raphael Mandelman as the president of the Board of Supervisors, who's been a long champion of our mission and of the HIV work that's happened here in the city. But it is a true budget crisis
Yeah.
here in the city. There's not enough money to deal with the vast issues that we have. We sat on a webinar in the last few weeks that asked us to prepare for an across the board 15% cut of health department budgets. In our world at San Francisco AIDS Foundation, that's something like $2.5 million. And that means taking a really hard look at our provision of services and trying to thoughtfully think about how we would make hard decisions about where we can cut to have the most minimal impact on the people we
Mhm.
serve every day if that full cut had to go into play. So we're hoping over the next few months, as the as the mayor comes up with his budget, as the Board of Supervisors reviews and does their add back process, that we will rally and advocate for the most minimal cuts possible here in the city.
I remember very, very well the first decade of HIV in San Francisco, and I remember, of course, the terrible loss, the thousands and thousands of people who did not survive, probably as many as 25,000 in our city alone. But what I also remember for the first really 20 years of this pandemic was the extraordinary commitment of so many hundreds of thousands of people who stepped up and marched and rallied and wrote letters and lobbied and visited their representatives and cared for the sick and created these systems that eventually did secure funding from the government so that people didn't starve to death because no one was there to shop for them. People didn't die on the street because housing was provided. People were able to access the medications as they became available, even though they remained extraordinarily expensive. So we made that happen. And listening to you this evening, and I really appreciate you so much taking the time to inform me and everybody else on this. But what the message to me is, it's all hands on deck right now, and people
Yeah.
need to right now make that decision to make a contribution, of course, but also plan your local fundraiser, whether it's a house party or a drag show or a big giant dinner, to step up with grant writing, to step up with the lobbying, to join our advocacy network, to understand that it is up to us. And in this moment in time, it is perfectly appropriate to be angry and frightened and profoundly concerned, but we do not have the luxury of giving up. We do not have that option. So I've been processing all of this since November, like everybody else, and I'm old and I am down for the fight. And I so appreciate your leadership and what San Francisco AIDS Foundation does, not just for us in San Francisco, but statewide, around the country, and indeed around the world. So thank you very much.
Of course. And, Cleve, speaking of stepping up, I just want to share that while we've been on the call tonight, board member Frank Duff and his partner, John Okaleski, have given a gift of $10,000 towards our
Wow.
$40,000 goal. We also have received a gift from our friends at Echo Torino, and we're seeing gifts come in from many folks that are logged in tonight. We hope that you'll share out the link tonight, sfaf.org/futures, that you'll consider making a donation, and that you'll encourage your friends and your family to donate not only to San Francisco AIDS Foundation, but to HIV and LGBT organizations that need your support now and in the years ahead.
Absolutely.
So we want to thank folks so much for joining us tonight. This is just the beginning of a long set of conversations that I think we're going to be having over the next couple of years. This may be the only time I get Cleve on Instagram, but I think that Cleve and I will be engaged in many conversations about what's happening in the world around us. We want to thank you for joining us. We want to thank you for staying engaged, and we want to thank you for considering making a donation to the Unbreakable Futures campaign. Thanks so much for joining us, and we'll see you next time. Bye, everyone.
Bye, everyone.